We're taking a look at something that's getting a lot of attention lately, gut health. What exactly does that mean is the question. Our chief medical correspondent, Dr. Jon LaPook, happens to be a gastroenterologist.
Yep.
That helps.
Yeah.
He's here to break it all down for us. I hear this all the time. I hear microbiome and probiotic all the time, and I don't even know that I fully understand all of it.
Right. So the gut has thousands of different species of bacteria, trillions of bacteria that are all doing all sorts of amazing stuff.
Okay.
And in fact, there is a whole burgeoning, it affects our brains, it affects our immune system, it affects things like the risk of diabetes and obesity. And people are really diving into, like, how does that happen? And there is a burgeoning field that I think, this is the first time I'm saying it on TV, called disorders of gut-brain interaction.
I love it.
So it turns out that the gut talks to the brain.
Yeah.
It has its own nervous system, plus the vagus nerve goes and it communicates. And like literally the gut says, well, not literally, figuratively, the gut says like to the brain, how you doing? And the brain says, how you doing? And they go back and forth with neurotransmitters and all sorts of stuff.
Does this mean like if I'm depressed, it affects my gut? Or if my gut isn't well, I'm now depressed?
In the other way around also. Mike Gershon, who wrote a book called The Second Brain, talking about that, said, you know, it's not in your head, it's in your gut. And so you get to probiotics and you say like, okay, how do we change or how do we even interact with it? How do we do something to make it better? And you know, it's a whole field of probiotics, and I did a 60-minute piece about this 5 years ago, and it's really, really tricky. I went to Israel, and they're doing these amazing experiments. It turns out that about half of the probiotics that you take, half of the time it just goes through you. It doesn't
that was
really
going to be
stick.
my question. Okay.
It's really hard to prove you know, what works, what doesn't work. They're making probiotics for dogs and things like that. And now what they're finding out, the Human Microbiome Project, is that everybody's microbiome is a little bit different.
Yeah.
You have your unique microbiome, so it's not just a matter of one size fits all. You really have to think about what's going on there for one person.
So a cleanse, does that work?
I'm not a believer in that, and neither are my colleagues. You know, it's a thought that, ooh, it's icky, it's stool, it's caking up. No, actually, I've done colonoscopies, and, you know, it's not caking up.
That's kind of
there.
a cleanse.
It is
That's a cleanse in itself.
I've also gone in there when the cleanse wasn't so good, and it's nice and well lubricated, but it goes out. I really don't think there's a lot to it. May psychologically feel better, but, you know, my guru with disorders of gut-brain interaction is somebody named Dr. Rachel Sarnoff, and she's out at UCLA, and she just texted me last night that actually it gets better post-menopause, so it looks like
Finally, something post-menopause that's going to get better.
And you know, things like bloating,
Sorry,
and abdominal cramping, and diarrhea, constipation. There's something about hormonal interaction, and also the sensitivity of your gut. It's hormone dependent, and it gets better after menopause. So congratulations.
This gut-brain connection. All I can think about is one of my stepfather's favorite criticisms of me when I would forget something around the house is I've got you-know-what for brains.
Well, no comment.
He was wrong. He was wrong.
Oh, what I meant to say was, how dare he?
Yes.
That's right. At least you said,
how dare he?
Look, it was the 80s. That's how people parroted.
Yeah,
Dr. LaPook, thank you very much.